Hello friends, I am Rashmi. Welcome to SRS Info. Today we are going to discuss the evaluation of tablets or standardization of tablets. This is the last class of the lesson tablets. We completed 15 classes about this pharmaceutical dosage form, especially on tablets, and this is the 16th class on this topic, and this is the last class on this topic of tablet. So let's start. In the last class, we started the topic of standardization of tablets and the main quality control tests which are carried out to test the quality of tablets. And we already discussed diameter, size, uniformity of weight, thickness, and hardness. And today we will discuss the next three topics, that is friability, percentage of medicament, and rate of disintegration. What's friability? Friability of tablet means the tablet is how much strong to withstand the abrasion. Okay, so this friability test is performed to evaluate the ability of the tablets to withstand abrasion in packing, handling, and transporting. There is a possibility of abrasion during this packing, handling, and transporting of tablet even after it's manufactured in a well condition. So, before going to this packing and forwarding, each and every batch of tablets are used to undergo this friability test. And the instrument which is used or the apparatus which is used to perform this test is known as the friability test apparatus or friabilator. See, this is the friabilator. Okay, it has two chambers, and this chamber can rotate 25 revolutions per minute. Okay, and we put tablets on both of these chambers and start the machine, and it will rotate for 4 minutes. So before putting this tablet into this cabin, we weigh the weight of the tablets. That is, suppose it's 100 gram or 100 milligram of tablets. It undergoes 100 revolutions in 4 minutes. After completing this revolution, suppose it will weigh 98 milligram. So the difference shows the friability. The standard friability is the breakage. It can be possible up to 0.8%. The weight can be reduced up to 0.8%. But if the reduction of the weight of this tablet after this revolution is more than this 8.8%, then it means the tablet cannot pass the friability test. But if the tablets are strong, then it will reduce the weight only up to or below 0.8%. Okay, here it's 2% in the case of this 98 mg. So this batch of tablets cannot pass the friability test. I just say an example. Okay, now in detail we will see in the written format. Friabilator. This is a plastic chamber which is divided into two parts, and it revolves at speed of 25 revolutions per minute. Okay, 25 revolutions per minute it can complete. A number of tablets are weighed. Before we putting the tablets into the cabin, we have to wait. A number of tablets are weighed and placed in the tumbling chamber, which is rotated for 4 minutes. That means it will complete 25 into 4, 100 revolutions in 4 minutes. During each revolution, the tablets fall from a distance of 6 inches to undergo a shock. That means during this revolution, this tablet will fall from a distance of 6 inch from bottom to center, from the top to center. Okay, it fall from a distance of 6 inches, which undergo a shock, and it may result in the breakdown if the tablets are not up to the mark. After 100 revolutions, the tablets are again weighed, and the loss in weight indicates the friability, as I shown you. And the acceptable limits of weight loss is less than 0.8%. Okay, if it's less than 0.8%, the batch of the tablets is okay. If it's higher, the batch will be rejected. The friability testing is a widely accepted technology in pharmaceutical industry because it's easy and it can be measured in a simple way. Clear? So this is what I explained to you. This is the friability. The next method is to find out the percentage of medicament. Again, it's very important. Suppose the paracetamol tablet of 500 milligram. Okay, its shapes looks like this. It contains a 500 milligram of paracetamol as a chemical. This test proposes that it has to be checked whether this tablet contains this much of the pharmaceutical medicament or not. This is the test. We know that tablets contain not only the medicament, okay, it contains other ingredients of also coloring ingredients, preservatives, coating materials, etc., sugar content. So all this contributes the weight of the tablet. But we have to measure whether the tablet contains the limited or the prescribed weight of that particular medicament according to the specific monograph of that medicines. This test is performed to ensure that every tablet, coated or uncoated, must contain the stated amount of medicaments within the prescribed limit. Okay? A number of tablets from a batch are selected at random and assay procedures are carried out. This is calculated by carrying out assays, and the result of that assay or that chemical analysis must be matched with the prescribed percentage limits of that monograph of the drug. Okay? Monograph is a detailed study analysis of that chemical or that medicament which can be used in human body. Okay? So the result obtained must be within the prescribed percentage limits. A number of tablets from a batch are selected at random and assay procedures are carried out according to the monographs given in that official books, and the results obtained must be within the prescribed percentage limit. This is the percentage of medicament. So the last test is rate of disintegration. One of the most important area to cover, to study for you. Why disintegration is important? Disintegration promotes dissolution. Otherwise, we can say that disintegration impacts or influences dissolution, and this dissolution impacts on absorption. Absorption of drug in the bloodstream or in the administrative part of these medicines in our body. Okay, that's why rate of disintegration of tablets is very, very crucial. The test is performed to find out that within how much time the tablet disintegrates. Important and necessary for coated and uncoated tablets, whether it is coated or uncoated, it has to be passed the rate of disintegration test. The dissolution rate depends upon the time of disintegration. Here, dissolution depends on disintegration, which affects the rate of absorption. Okay, so the absorption depends on dissolution and the dissolution depends on disintegration. So these are mutually related. That's why this disintegration rate of a tablets plays a very important role in its ADME. That means absorption, dissolution, metabolism, and excretion. This is the disintegration test apparatus which is used to check the rate of disintegration of the tablets within the prescribed time. So this is the apparatus. Okay. First I will read about this apparatus and after that I will explain you. This apparatus consists of a glass or plastic tube which is open at one end and the other end is fitted with a rust-proof number 10 mesh sieve. Okay. And the tube is suspended in a bath of water or soluble liquid maintained at a temperature of 37 degrees centigrade. The tube is allowed to move up and down at a rate of 30 times per minute through a distance of 75 millimeter. Look here. This is the plastic tube. Okay. In the lower end of this tube is ended up with a mesh of number 10 sieve. Clear? And the upper end is open. And this is covered with a vessel, and this vessel is filled with liquid, and it is adjusted or it is connected with a holder so that it can move. This tube will move up and down at a distance of 75 millimeter. Okay, and the fluid within this vessel is adjusted in such a way that when this tube goes up, it will break the surface of the liquid. Okay, and when it goes down, it will reach up to 2.5 centimeter above from the bottom. Okay, and in such a way the tube is adjusted, and the movement is adjusted in such a way that within the 75 millimeter of distance, this tube goes up and down 30 times per minute. Okay, so this is a setup. The tablets is within the tube, but the bottom is adjusted. Bottom is connected to a mesh sieve of 10 number, and the upper side is open, and this tube is inserted or fitted in a vessel which consists of liquid, and the quantity or the volume of the liquid is adjusted in such a way that the tube goes up, the bottom will touch the surface or breaks the surface, and when it goes down, it reaches up to 2.5 centimeter from bottom, so that the dissolution can takes place properly. Okay, and within the 75 millimeter distance, this tube will comes up and down 30 times per minute in such a way that this mechanism is arranged. That's written here. Glass or plastic tube open at one end, then in the lower bottom it is number 10 mesh sieve. The tube is suspended in a bath of water or suitable liquid maintained at a temperature of 37 degrees centigrade. The tube is allowed to move up and down at a rate of 30 times per minute through a distance of 75 millimeter. The volume of the liquid and the distance of the movement is adjusted in such a way that at the highest point, the mesh screen just breaks the surface of the liquid to give a turbulent movement, and this liquid surface is adjusted in such a way that to provide a turbulent movement to the tablets, and at the lowest point the mesh screen remains about 2.5 centimeter above the bottom of the container. Okay, clear it? Then what will happen? 5 tablets are placed in the tube along with a plastic disc over the tablet. This is the disc over the tablet. The tablet is put here, and what will this disc do? This disc over the tablet does not allow the tablets to float. Okay, and it imparts a pressure on the tablet so that it disintegrates properly and releases through the sieve into this liquid. The tube is allowed to move up and down, and a disintegration time noted when all the tablets have passed through the sieve. The machine started, disintegration time is noted. The duration, the time taken to disintegrate or dissolve the tablet and to pass through the sieve, the time is recorded. That time gets matched with the time recorded in the monograph, and this time should comply with the time stated in the monograph. Then the batch of the tablets passed the disintegration test. Otherwise, it will fail the test. The test fails if all the tablets do not pass through the sieve within the specified time. Okay, within the specified time, if all the tablets pass through the sieve, then it is mentioned that the test is passed by the tablet or that batch of tablets. Otherwise, it will be rejected. And normally, the standard time required for the uncoated tablet to disintegrate is 30 minutes, and for coated tablets, it's 1 hour. Clear? So for uncoated tablets, it's 30 minutes, and for coated tablets, it is 1 hour. That is the standard time required to disintegrate for these tablets. And I told you that disintegration impacts on dissolution, and dissolution makes impact on absorption. Now we covered disintegration test. Okay, so along with this or adjacent to this, we will discuss the dissolution test apparatus also. The rate of dissolution of a solid drugs plays a very important role in the absorption and physiological availability of the drug in the bloodstream. If the absorption is proper, then the medicine can be available physiologically. If the medicines cannot absorb properly in the body, so it's not possible to make it available in the bloodstream. So physiological availability of the drug in the bloodstream is very important, and that makes possible by this dissolution, which in turn makes influence on this disintegration. So this is the dissolution test apparatus. Okay, this is the vessel of 1000 ml, and it consists of this basket, steel basket, which consists of tablets, and this vessel have 4 holes. Each hole has its own purpose, and this vessel also consists of the medium. Again, it's up to 37 degrees centigrade, and this temperature should be maintained. There is a possibility of variation of plus or minus 5 degree. In the case of disintegration apparatus, the variation can be possible up to 2 degrees centigrade in the temperature condition. Clear? Now, first let me read, then you will clear about the picture. The dissolution test apparatus consists of a cylindrical stainless steel basket, the small basket, which consists of the tablets. Okay, and this basket is attached to the end of the stirrer shaft. The 1000 ml vessel made of glass or other inert transparent material fitted with a cover having 4 holes that I have explained to you. 1000 ml vessel, and this is the basket. Clear? And the basket is attached to the end of the stirrer shaft. This vessel is made of glass or any other transparent material, and this is fitted with a cover, and this cover has 4 holes. Clear? And one hole is for the shaft, one hole is for the shaft, other hole is for placing the thermometer. Why thermometer is important? Because to maintain the thermostatic condition of 37 degrees centigrade here. And third and fourth hole is for removing the samples. Where will collect the sample? The sample solution will be in the vessels. I will explain you how. Variable speed motor driven stirrer which rotates at a speed of 25 to 150 revolutions per minute. Okay, and this shaft, due to the help of this shaft, the stirrer, the speed of the motor driven stirrer rotates at a speed of 25 to 150 revolutions per minute. Okay, and the thermostatically controlled water bath to maintain a temperature of the dissolution medium at a temperature of 37 degrees centigrade plus or minus 5. Then what will happen? The dissolution medium filled in the glass vessel which is submerged in the water bath. This is the water bath, and the dissolution medium which is filled with the glass vessel, okay, which is submerged in the water bath, and the dissolution medium can be distilled water, hydrochloric acid or phosphate buffer, but the condition is the pH should be 7.3. Clear? The dissolution medium is filled in this glass vessels. Okay, this glass vessel of 1000 ml, and this volume is filled with a medium, and this medium can be distilled water, hydrochloric acid or phosphate buffer, and the pH should be 7.3. And the temperature of the water bath, this is the water bath, and the temperature should be maintained at 37 degrees centigrade. Why 37 degree? Because this is the normal temperature of a healthy human body. The tablets or capsules to be tested is introduced in the basket and fitted in the position. This is the basket. Okay, this is a steel basket, and the tablet or capsules is inserted in this basket, and this basket is fitted in the position within this vessel. Then the motor started. The stirrer is here which helps to rotate this basket also, and with the motor started and its revolution adjusted according to monograph. In how much speed or how much time, in how much rotation should be completed will be done as per the written monograph. Then the samples are withdrawn at specified intervals. From where you get the sample? This is the bath and this is the vessel. Okay, and this is the basket, tablets here. What will happen when it rotates? The tablets gets dissolves because the basket is steel and this has small holes, and through this small hole the dissolved tablet is spread in this medium. Clear? and this medium is considered as sample now, and these samples can be removed from this two holes. Okay, I have told you that there is four holes on this the cap or the cover of this vessel. From the two holes the samples is removed, and at the same time what will happen, this sample, the volume of this liquid and this medium is replaced simultaneously. Only then the process can be continued. Clear? When the sample is removed from one side, the liquid is filled in this or replaced in this vessel. Then 5 ml sample solution is withdrawn each time, which is replaced with 5 ml of the medium, and the temperature of that medium shall be maintained as 37 degrees centigrade to maintain a constant volume in the vessel. Okay, the constant volume is very important so that the dissolution takes place in the same conditions. The chemical analysis of the drug dissolved. From where we get this drug dissolved? From this medium. Now, in this medium, the tablet gets dissolved in this medium. So, this medium is treated as a sample which contains the qualities of the tablet, which was inserted into the basket. The drug dissolved should meet the requirements stated in the monograph. Clear? Now, we completed the topic tablets. The tablets are very important unit dosage delivery forms, and this topic is very important in pharmaceutics. So, with the 16 classes, we completed this topic in detail, and this is more than enough for you and for DPharm examination. From the next class in pharmaceutics, we will meet with a new topic. Thank you.